Norton Children's is planning a new pediatric care campus, including a second children's hospital over in J-Town, and it wants your help in deciding how it all takes shape. Norton Healthcare CEO Russ is joining us here on the Noon Show to explain how you can share your thoughts during a virtual session coming up in just a few days. Thanks for joining us today.
Thanks so much, Brooke. Appreciate you having us.
So everyone knows about Norton Children's, specifically downtown. Number one place you're going to take your kid when something goes wrong. Why this pediatric campus in J-Town? What's going to go there?
Well, we want to grow pediatric care, not only for Louisville, but for the state and the region. And we think the opportunity to continue to have this vibrant campus downtown and continue to grow outside of it in a place that's very accessible off of I-64 in the Snyder, we see it as a great opportunity for us to be able to reach more people in the region and state by having additional services.
So we talk campus, we're talking hospital and then other offices. What would go there? We've
got 150 acres that are going to be dedicated to that pediatric patient. We're going to have everything on this particular campus that you can imagine. And it's going to also focus not just on the pediatric patient, but on that family. We're going to have services there that are going to be able to take care of all the needs of a family, an extended family, for a child that's in a stay with Norton Children's there, so that all they have to worry about is the health of that child. You know, we're going to have hotels out there, we're going to have restaurants. Hopefully we're going to have some housing for some people who want to work in that facility, that be close to work. But 150 acres solely dedicated to the care of children.
When you're talking about that location and the community input, you guys have already had in-person meetings with the public. Now this is a virtual one coming up. What have you heard so far?
We're hearing a whole lot of things that are very encouraging to us about incorporating things that are already in place out there, from the terrain, the landscape, the nature. So that's one part of it. But where our ears are really perking up is the interest that people have and the awareness that they have for the needs of mental and behavioral health services for adolescents and children and preteens. We're seeing so much more of that as a need with not many places to go. So we're listening very carefully to that, and we think that we're going to be able to have a great blend of mental and behavioral health services that will help in those other type of acute care services as well. So we're going to emphasize getting out in front of the mental health perspective as soon as we can.
So let's talk about when this first virtual one is and what you can expect going into it.
You know, we as you said, we've had these in person throughout the state and the region. We've had 6. This is our 7th. It's virtual. We recognize that not everybody can get out to an elementary school and give us 2 hours. So on February 17th, we're going to have an hour of a virtual session. You can sign up on nortonchildrens.com. Where we're going to listen. You know, we listened with Norton West Louisville Hospital. We had sessions like this, and we gleaned so many valuable bits of data. You can see so much of what we heard in the design of Norton West Louisville Hospital, that this virtual session is going to give people who otherwise wouldn't have an opportunity to go somewhere and tell us what they think an opportunity.
Right. And as you mentioned, we know this goes well beyond the Louisville area. So take a look at your screen if you haven't already, nortonchildrens.com/listening. That is where you want to go to register to be able to take part in the Follow the Balloon virtual session. CEO Russ Cox, thank you so much for joining us today. I know a lot more is going to be taking shape, and we can't wait to see it.
Thank you. We've had over 4,000 people fill out surveys. So if you can't come and show up on the virtual, please go on and fill out a survey for us. We want to hear what you have to say.